Did you know that most chronic pain isn't caused by anything you're doing wrong? That pain in your back, your shoulder, your hip, it's not because you didn't stretch enough or do the right workout. It's a predictable result of modern life. How we sit, how we move, how we're born into gravity and stress. That's why stretching, yoga, and bodywork can feel amazing. And then the pain comes back. Neel Bulchandani has spent nearly 2 decades studying why that happens. He's a chiropractor by training, but his work looks at how tension forms through development, fascia, and the nervous system, long before pain ever shows up. In this episode, we talk about why pain keeps returning and what changes when you stop chasing the symptoms and start understanding the system underneath. Welcome to Hydrate. I'm excited because in today's studio, we have Neel. How do you say your last name?
Bulchandani.
Bulchandani.
Yeah, there you go.
It's a beautiful last name. I had this amazing experience of meeting Neel through our mutual friend, Ben Greenfield. He reached out to me and said, you need to meet this guy. And I'm like, okay, send him over. So he comes over from Santa Barbara, where his clinic is. And all I know is that he's going to do some unique body work on me. He's a chiropractor by trade, but so much more than that. What he does, I can't even explain. So we're going to try to go deeper into it, into the show. But I had a 3-hour session with him last night. And all I can say is many of the things I have been trying to work through, like a stuck sacrum, calves that are always tight, multiple things in my own physical body that other body workers have not been able to, like it kind of relieves it for a little bit, but then comes back. For now, I'm feeling like, whoa, like what did you do to my body? Because it's almost like it melted the stuckness, and you didn't even necessarily go to the spots. You were working on things like the inside of my mouth and my toes. And so let's get in and talk about this, because I think it's so interesting. And I know that the listeners there's not one person that doesn't deal with some sort of ache or pain or discomfort or tightness in their body, that sometimes we want to go to that spot, but it's like a referred thing, a referred pain. And body workers will definitely usually try to work on that area or somewhere near it. And I want to hear from you, like your approach. First, we want to get to know you a little bit. How did you get started? So we're going to go into this. So thank you for being
here it's good today. To be here. Happy to be here. And yeah, I'm excited to delve into it. I think the hardest way to describe like the work is to say, I told you like 8 words. I'm like the fusion between like these many fields, but I love your podcast and your concepts on like talking about hydration from a multifaceted perspective. I mean, I look up, see the clouds and they are moisture, and then we have like water that freezes and it's so hard. And so I do think of like fascia that way. But I also like to say, I think I said this to you yesterday, I'm like, I really care about fascia, but what's underneath that? It's like we are in a time where we've been talking about the body without fascia, and now we're like hitting that topic of fascia. And I've heard some amazing healers on your podcast share their expertise, and I'm like, oh, I love that. So, but I look at my work as like phase shift work.
Phase shift, okay.
And it's like taking your body from like one phase that it's in, which might be like, I mean, you've like cared for your body really well. You've had like, from hydration and like the full gamut of bio-optimization and bioharmonization, but it's like, there were some areas that I'm like, oh, that area hasn't been freed. And so how can we get that hardened or frozen or rigid area unlocked? And I'm like, it's probably been worked on this way, or like the ways I've worked on it. And I'm like, ooh, but how can I go to where that came from? Which is usually like the embryology, how we form.
Yeah, you were saying that to me, which was so fascinating. You had mentioned that some of the things that were stuck could have been in utero, and you were noticing, oh, this, like, give an example of something that was stuck that you're like, this is probably in utero.
Yeah. I mean, there's like your like the tension on your Achilles tendons and the calf muscles, I'm like, oh, it is rigid. And there's a bunch of reasons like that could be, but usually by now I can feel like when I see like the left leg has like fascial tension on the gastroc muscle and the soleus, and it inserts it at a certain place on the tibia, that's usually when this like pharyngeal arch formation issue happens. And
you're pointing to the mouth when you say
pointing
that.
to the mouth.
A lot of people don't know.
So in the mouth,
Pharyngeal arch
totally
formation.
mouth. Yeah, mouth formation issues.
Yeah.
And that happens in the first like 4 or 5 weeks when you're forming in utero.
Forming. And
the palate's forming, the
left
tongue
right
is forming.
hemispheres coming together.
Totally.
The head and everything.
Everything comes together there. The other thing happens is, so the tongue forms, this place under the tongue called the frenulum or frenum forms. It's this band of connective tissue that connects it to the floor of the mouth. And the floor is this soft space that's inside the jaw, that's beneath the tongue. And that is like the place that I've been poring over, investigating, categorizing in my mind and on like all the patients that I've seen. Like what happens at the floor is like a mirror and a like an aperture, a lens through which I see the body. And so I've created a system on how to address the floor of the mouth and to then see through the floor, like you would see a reflection in the water. What's the rest of the body doing as a result of what happened in the floor in utero? Mm-hmm. And then how can I go to those places? I have a map that I created that has like 70 places in the body that when the mouth forms weirdly or not in an ideal way, like tongue tie or the maxilla, the palate's narrow, or when you have tori, which are these bony growths on the jaw, like those things I know, we know in the field of airway and feeding healthcare, we know those things happened in utero. So then because of the work I've done for like the last 9 years specifically in that, although I've been a healer chiropractor for 17 years, it's that work where I can see, when I see that tension on the calf muscle there, and on the right side, I see that calf muscle insert into a different place. As in meaning, I'm going to like disrupt some of the knowledge about anatomy here. If you don't have tongue tie or like palate narrowing, you don't have this other way the muscles insert to a different place on the tibia. I've seen this over like these 9 years of categorizing countless patients. So when I see that on you, I'm like, I'm pretty sure that if I find where the mouth has tension and where in the body or in the spirit or the emotions, where in the body there are trapped tension, and then how that can unlock the mouth once the mouth frees up, the lips, the cheeks, and then this upstream, downstream, like diffuse shift happens in the body where it turns like something from rigid to like butter. And
we felt that in that one session, how my calves just went from being so tight to melted almost. They're in that fourth phase. So how many people, what percentage of people would you say have a narrow palate or tongue tie?
Yeah, there's a lot of talk about like, is it that we are seeing it more because more eyes are on it, we're more aware of it, or is it really a growing issue? I think it is both. So if you were to talk to some people who have been in this field for like over 50 years of looking at this, there's a trend of seeing an increase, especially in the last like 5 to 10 years. Whereas it started out by them saying it was like 2% of people. I think we're at like 60%.
Wow.
So
it's a huge discrepancy.
Huge discrepancy. But part of that was the 2% was a really bunk stat that wasn't.
Yeah.
And then it was 10%. Now people have said like 30 or 40%. But, people like James Nestor with Breathe and other people who have come out in our field with knowledge of that are saying like it's due to like the anthropological changes that are happening, and we're just eating, we're not getting enough chewing, and we're all these things, the pesticide, I believe, some of that is all the environmental toxins. Some of that's there. And so I think it's just basically been on a steep increase in the last few decades, because I'm seeing it a lot more in my field, my practice with people now than before. But when I see like 80-year-old that has this issue, I'm like, that 80-year-old is not dealing with the increase from 5 years ago. Not only is that 80-year-old dealing with this issue because they grew up with this, they were born with it, but usually that information comes not from their parents, it comes from the egg that formed them. And the egg that made that person that's 80 happened when that egg was in the mom that was in the mom's uterus, right? So we're talking like 2 generations.
Wow.
So it's been there forever. There's a lot of references to it that have been around for, a long time.
Yeah.
I think there's been an increase in, so over half people have this issue.
Both of my daughters had tongue tie, and we went and got it lasered, but I had no idea the depth that I learned from you last night, how there's just so much more. It's not just about getting it lasered. And then I had my mouth checked and they said, no, you don't have any tongue tie. But when you and I were working together, you said it was slight. It was so subtle that maybe it got missed, but it's there enough that it's impacting certain dynamics in my body.
Yeah.
Function, right?
Mm-hmm.
So I love that. I was like, wow, I love to learn new things, because once we know something, it's not bad news, it's good news, because now we can do something about it. This education. You mentioned something about chewing, and I want to go back to that, because we live in a society now where, I'm speaking for myself, I love a liquid diet in a lot of ways. I live off of elixirs, smoothies. I mean, it's just like on the go, quick, easy way to get nutrition. But they always say, chew your liquid and drink your food. Because tell us about that. You're supposed to actually chew to create mastication.
Yeah.
When you're drinking a smoothie, not just gulping it down.
Totally. Yeah, my sister Shivali is like a great example of like, she would drink these like smoothies that look like mulch. And I'm just like, what? It's like, because I was a latecomer to holistic, ways. Yeah. Growing up in like Western-based kind of household, I was, used to things that just tasted good and sugary. But then, my sister started introducing holistic ways. So she started bringing in these smoothies, and I'm like, that looks like you just barely blended it, right? I'm thinking like so I wanted like a smoothie that was perfectly blended, that was liquid. So I grew up kind of like, I see her, and then I started having them, and I'm like, ooh, but then now I love that, because I know, okay, it might not taste this smooth, but I'm going to chew those bits.
Yeah.
And it's a little easier to chew when there's something to chew. I think it's hard to chew when there's nothing to chew, because when you're having soup that's purely liquid, it's good. I think we need like a blend of liquid and kind of substances that we can chew. But there's also things like the Mayo Munchie, and it's this like really great tool that this person named Mary Burke designed. And it's like this silicone-based thing you can put in your mouth, and you chew, and it's really meant to grow your jaw. And it's predates some of the recent ones that have come on that you've seen. This is a chiropractor who inherited this company from her dad, who was a dentist. She's been on my podcast. She's brilliant. So I think the Mayo Munchie is a good way for people who are like, maybe I'm going to fast, and maybe I'm going to have smoothies a ton, but I'm going to use this Mayo Munchie and get some good chewing in. But yeah, chewing activates these enzymes that help break down food properly, so that when our digestive system gets it, that it's easier, and so elimination easier, so we get toxins out, because toxins can be one of the reasons that we have these issues.
Really?
They can add to it. So I think there's that part, but then the actual movement of the jaw. So, but I think,
what does the movement of the jaw do besides creating mastication and like having your body produce those enzymes? What does it do for you functionally that we're missing out on when you say we're not chewing as much as we were?
This will go back. I'll ask you this question again, just to see. You don't have to name the muscle names, but what would you say, like, this is a survey of what most people we would say. What are the main areas of muscles involved with the jaw? Like, just throw out face.
We've got in the face, I don't know, there's the masseter, we've got the temples that are working, we've got our lips.
Totally. So the main, we think of like jaws that chew, but we have muscles not only in the palate that control what the palate does and the mandible does, that start here in the hyoid. When we worked on you.
The hyoid, yeah.
The hyoid is the throat bone. And some people are like, I didn't know I had a bone in there. I'm like, I know, we don't talk about it enough growing up. The hyoid is the throat bone, and it is this rectangular bone that has muscles that go up into the floor of the mouth and into the jaw, and some that even run up into the areas that connect to the pterygoid muscles. So this is the main bone of chewing, and it's in the throat.
Your hyoid.
The hyoid.
Okay.
So it's the chewing bone, swallowing bone,
This is
speech bone.
your thyroid.
It's behind the thyroid,
Okay.
and some would say it's, if you're thinking of the axis or C2 and C3, it's like right in front of those bones.
Okay.
So I would say this is where I would, a lot of people that have C2, C1 occiput, like upper cervical problems, chances are it's coming from the throat bone being out of place. And that thing,
The hyoid.
Yeah. So the hyoid is hugely mobile because it's a floating bone. That means it's not connected to other bone.
It's connected to the fascia. Or
All muscles and fascia.
Okay.
Yeah, muscles and fascia working in unison in that tensegrity model that Buckminster Fuller came up with out of Big Sur Esalen back in the day and influenced Ida Rolf, even with Rolfing and structural integration. But like that hyoid bone is housed in a sea of muscles. And so those muscles even go down into the hyoid and into even the sternum.
Okay.
So chewing influences not only the thyroid, but the sternum. And then even when we talk about the abs, like we were working on yours, it influences that.
Wow.
So
how does it influence the thyroid? Is it bringing blood flow to the thyroid? Is it helping, how is it helping the thyroid?
One of the ways that it's really, this is really like tricky and nuanced because sometimes it actually does not alter the way the thyroid works, which is like metabolism, temperature, energy. But sometimes it does. So it can alter that. So if your hyoid is stuck, it can misalign your thyroid and it can make you really cold when it should be warm. And it could also affect the way that you handle stress and all the things that the thyroid does with metabolic health and hormone health. But I look at this through the perspective, and I'll, probably a little bit later, I'll tell you, like, the way that I got into all this was because my daughter was born with a tongue tie 9 years ago. Threw me down the rabbit hole of investigating this because we're seeing her struggle with breastfeeding, and my wife was trying to feed her, and it was painful, and it was so hard.
Yeah.
So
I can relate.
Yeah, you can relate.
My first daughter was like that. She's like slurping.
Yeah.
And that's very painful for the mom too. When you're
so painful. So quickly, we were like, what do we do about this? And I think we had friends. They have this system called Fascial Care, Chandler and Raul Santiago, amazing healers. They told us, they were friends with my wife and I became friends with them. They told her about all of this tongue tie world.
Wow.
So they gave us things to look at. We went and researched. Our midwife spotted it, actually, Becca Frankie, and she's amazing. So we investigated it and we started to okay, but within 2 weeks felt like forever.
Yeah.
So 2 weeks later, she had a laser frenectomy. That's the laser tongue tie release by a pediatric dentist. Dr. Sherman Yazdi in the Bay Area, he was amazing. And it was like night and day.
Mm-hmm.
But I did 4 to 6 weeks of post-op stretches to help make sure the tongue didn't reattach in tension. And then 3 months of where there's this window of neuromuscular change where we can still see change happen in the body. And I found that in that 3 months after the release, I was still doing body work to help my daughter Serenity optimize and get the full effect out of it because she had all this gas and bloating and writhing that would keep her up in the night. But the tongue tie release plus the body work helped with so much of that. So we're thankful for that. But I started to look at, then I started to see other babies, kids and adults with this issue, and I started to specialize in it. And I started to see, why are these, like I was telling you, I'm like, what? I try to work now with how can I reverse engineer what should have taken longer in more sessions in a shorter amount of time with less needed? Because I don't want people to have to go through tons of sessions to experience results. So yeah. One of those things was I started to see the thyroid was misaligned and it was making that throat bone stuck.
So many people have that issue.
I think there's a certain percentage, so if we say 60% of people have tongue tie or airway issues, within that, I have 4 phenotypes. I'm not going to go into those, but about a quarter of them have this issue with the thyroid being misaligned. And that's you. So if anybody listening and you have a jaw that's stuck back, a retrognathic mandible, or you have an overbite, there's a possibility you have a thyroid that's stuck. But back to your question of if we free the thyroid or the hyoid or both at once, what happens? even though sometimes it leads to beautiful changes with thyroid health, that's more like, great, I would love that when it happens. But what does happen is these stuck back jaws that are stuck back so far that it's one of the hardest things for a mom trying to feed their baby, or even a dad trying to bottle feed their baby, is when the jaw is stuck back, it can't open well, and then that baby tries to chomp and tries to chew when it doesn't need to, instead of rhythmic sucking. For kids, it traps their fascia and it inhibits their nervous system to be able to regulate, so they're stressed out, scattered. We could even talk about ADHD, but in adults, they just don't get right airway. They have sleep apnea, things like that. So the thyroid is a huge player in that. And so when we can free the thyroid and the hyoid, I called this move the mandibular glide. I can see that mandible like glide forward.
Whoa.
And open up the throat, open up the airway, get the tongue to lift and do what it's designed to do, which is to breastfeed if you're a baby, or bottle feed, or all the other things that we need the tongue to do, which is tongue should go to the top of the roof of the mouth, so that it can...
That's where it should rest all the time, right?
Yeah. And so that we can breathe through our nose.
Tongues are resting at the bottom of their mouth.
Yeah.
This was a whole new thing for me when my daughters, before they went to get the laser done for the tongue tie, we were seeing a myofascial specialist, and they saw this lady for like a year because I wanted to work with her before we did orthodontic care, to just make sure, like, to prep for it and to make sure, do they really need this?
Totally.
I'd heard mixed reviews, and maybe you can give us some information on it, but that orthodontics can sometimes not be great for the developing brain and the developing cranial situation. So is that true? Tell us a little bit about that.
Yeah, I think it's like, so I could get into the weeds about this.
Yeah.
But I'm more like an advocate and a support system for families when they, as an adult, or their kid or their baby needs help. I'm like, how can I serve you? But I do collaborate with some of the world's best in terms of orthodontics, airway, tongue tie releases, jaw surgeries. I mean, I could list like 10 names of people or 50 names, and I'm like, these are people you need to see because they are experts in that part of it. But what I do is I find these areas that are, kind of sneaky hidden, like the thyroid or like the right kidney. And I'm like, this is what we need. So I really do come alongside families, kids, adults, before they're going to get palate expansion or even orthodontia or even like braces. So I can help free up these areas in the body that promote greater growth, and so that process is easier. And then also afterwards, so their bodies can come into this like balance and homeostasis. So there's so many different like camps out there, but I think that so much can change. Like the sutures, the cranial bones, they're sewn together, but they're not fused. Mm-hmm. So if they're sewn together, they can change forever. And that's understood. Mauro Zapatera, who's an expert on cranial, the cerebrospinal fluid, out of Harvard, and talks about this, but so many other healers talk about this too, that we can still make change until we're 80, 90, 100, 120, whoever wants to live to 140. You could still change all of this. And I think there's a lot of healing ways that we can do it holistically, but then there are some people that were born with tongue tie, and that's pretty extreme, or we're born with palates that are so narrow that holistic, or at least non-palate expansion, non-surgical intervention doesn't work. For those people, thank God for like these surgeons and these people who can provide the right tools, the right appliances, and the right expanders to help widen the palate and bring the jaw forward. I've supported a lot of people through like some processes that are really hard. Like they have to get double MMA jaw surgery. And,
wow.
Before that, they couldn't breathe. This one person, she would collapse onto the floor every day after working because she had such a narrow airway. She couldn't get air. And she got some of these surgeries done, and she now can breathe and flourish. But yeah, I love it when we can get to babies early, help this from the get-go, or like your kids, you help them in their earlier years. But I think it's never too late too, because I've seen adults who are like 50, 60 years old who have had their palates expanded.
Wow.
And they're getting better breath and better oxygen, better flow through their whole bodies. So there's a lot that's possible.
For the people listening to this, how would they know if they have a narrow palate and there's something that they can do to improve it?
Yeah, and there's also the talk about You could have a narrow palate like left to right, like transverse width. You could also have altered dimensions of a palate front to back. And so and then I'm leaving out tons of technical jargon that my dental and, colleagues would talk about. There's some ways to know. I mean, if you stick your thumb up on your roof of your mouth, inside your mouth, and you feel the palate hugging your thumb, hands down, you've got a narrow palate. If you're like, older than 12 to 14 years old. If you stick your pinky on the roof of your mouth and it's hugging, you've got like a severely narrow maxilla or palate. But if you put like two thumbs up there and like, wow, it's like a big bowl. It's like, it's so smooth and so, there's so much space, then it's like, you may not. But where I'll like say, like, sometimes that doesn't tell us like how, for one person, a little narrow affects them a lot. And for another person, their narrowness doesn't affect them as much. So I think we go by things like the Aura Ring and checking sleep metrics, checking how rigid somebody's bodies are, how rigid their Achilles tendons are. If you've got inner thigh muscles that are so tense that they don't open up if you try to do the splits, or if you've got traps or, trap tension, trapezius muscle tension, or like SCM muscles, sometimes those are like clues that your body might not have the right amount of movement for your tongue, but there are other times when that's a clue that your palate's not broad enough to house your tongue or to be the proper place or home for your tongue.
And that's something that usually orthodontic care helps with, though, right? When you're younger, where
yes.
they put the expanders in.
Totally.
Make the palate bigger. Okay.
Yeah.
But sometimes maybe they're missing the tongue tie.
Yeah.
And those go together, right? Because the tongue at the roof of the mouth is while you're developing that. If it's right and you don't have a tongue tie, the tongue at the top should be helping that palate expand as you grow, right?
Yeah.
So they usually go together. So you have a narrow palate. Even if you've had an expander, you probably have a little bit of a tongue tie.
Yeah. Such a beautiful thing, because it's like some people they've had like the best orthodontics, but they haven't had the tongue tie release. So then the thing that should be shifting that palate every day, many times during the day, whenever they breathe, it's not free to do that. And there's some people that, they've had the tongue tie release, but they haven't had the palate expanded, and that's harder on them too. So there's more and more like airway-centered providers, airway-centered dentists, and some ENTs who are spotting that. And they're looking at, okay, we know we have these things going on. So what do we do first? Do we expand first or do the release first? So that's become a lot more of the dialogue today. It's like, we know it needs to be done, but how do we know when? Because if you release a tongue when there's no space for it, then the tongue just jams against the roof, and that's hard on people and actually makes more stress in the body. So then we need to expand first, or they might guide a patient that way. Flip side of that is if, that, like we said, if the palate is expanded, but the tongue isn't released, what happens when you release the tongue? It might actually create more change. So I think it's really good to just kind of get a really thorough assessment where somebody's evaluating all this and they're savvy at talking about all this. So a lot of people now, I mean, you look at all the forums on Facebook and some of the people know, moms especially, they're going to like investigate this.
Yeah.
And so they're like really asking hard questions to the providers out there of like,
great.
So good. We need that. Yeah.
So yeah, because these are so many things that we get to learn, and I've been learning them as an adult, as a mom, that I didn't know when I was younger. So I had orthodontics for like 6 or 8 months, not very long, but I don't remember them using an expander or anything like that. But I've heard that as you become an adult, those sutures are harder to move and you can't expand it, but you're saying that you can.
You can. And one of my friends and colleagues, Dr. Kevin Boyd, he's a pediatric dentist, expert out of Chicago. One of the most historied in the field. He's like, their big movement, Children's Airway First Foundation, also that I've been on their podcast, is like, before 6. If you can do this before 6, you can make so much change way more easily. But to all the people out there who are like, I didn't know about this when my kid wasn't 6, right? I mean, it's going to stress you out, right? So I'm like, we take it easy, right?
Doing our best.
Just doing our best out here. I'm one of them. We in our family are like, we know it all, but can we do it all? No.
Yeah.
So before 12 or 13 is another.
Also, it's expensive too.
Costly.
It can be.
And sometimes I've seen people come in and they've been down all these different kinds of treatment, and there they are at 25, 30, 35, 40, and they spend a ton of money, and sometimes they didn't have things that helped them, and they did a lot of this. But so, I mean, that's why my podcast is called Compromise to Alchemize. Shameless plug right here, because, or like that, it's like the phrase, I was talking to my wife, Dawn, I was talking to her late one night, and I'm like pacing around the house. I'm like, how can we go from a compromised airway to an alchemized airway? Because we're so compromised, and like, this is so messy. This is so hard when you're in the nitty gritty of this, or when you're a parent with kids, you're like, oh my gosh, what do I do? When do I do it? When do I have time to think about what to do? And, you know, like, but
we're just all trying to survive. We're trying to just drink the healthiest smoothie out there.
no, and then chew it whenever we can, right?
We do.
See, that's why I'm chewing. No, I'm just kidding. Lozenges to help me so I don't cough, but I'm also chewing it.
Like how do we do all the things? And it can sound so confusing and so overwhelming.
Well, that's why I got rid of the airway part. Because how can we go from compromise to alchemize?
Yeah.
It takes a village, and it takes friends and support. And also, it isn't through this healing modality or that. It's through like words of affirmation, or my wife's work in embodied validation. She's getting her PhD on that, and she's putting forth this work where it's like, sometimes the best healing doesn't come from a body worker. It doesn't come from a expander, because people have done all those things. It comes from like that one moment you look at the sunrise and you're in the ocean and you cry, and you're like, all of a sudden everything melts and you find hope, but you also might find healing. So I think we need to, like, you know, hydrate. We need to look at how do all these things work, because it's not just about if your palate's narrow, widen it.
Spiritual, we're emotional.
So much more. So I feel like we gotta like look at the broader picture and find, we might be doing everything, but then somebody else is going to mention, well, what about this? Have you done that? And it's like, well, no, but how can we integrate and come to a place where we're seeing change happen and helping bring about healing? And so I think we have like taking a grounded approach to some of this.
I love that you said that, Neel. I really appreciate that you brought that up, because it can get overwhelming. Even this conversation we've had is so educational, and it helped me, and I'm sure so many people are learning from it. But there may be some people listening to this going, oh, another thing I need to do.
Yeah.
Right? Or, oh, wow, I didn't realize that I may be broken in this way too. And it's not saying that we're broken. We love to learn so that we can always optimize. Also, what you said about being these spiritual beings who it can be an emotional thing. And sometimes the most potent medicine is love, and learning how to love ourselves. And it's so generic, but it's like a journey, because I feel like we're all learning how to do that. And it's like an onion, you know, layer by layer. Once you think you love yourself, you get hit with another challenge where you realize, maybe I don't to the level that I thought I did, because everything's a projection, a mirror of ourselves. So to the level that we can love others is the level that we can really love ourselves. And it's this constant learning, and we're growing. And I love that, because the show is about education. It's about learning. We want to understand things, but we also don't want to feel overwhelmed and like something's wrong with us. You taught me so many things about myself that I didn't even know last night. And you gave me hope too, in that you didn't just tell me, oh, this is out of balance or that. You were like, okay, here's what we're going to do about it. And I love that. So let's talk a little bit about, if somebody is listening to this and they're like, I want to invest in this. I want to go further with understanding this, because I'm dealing with low energy during the day, or maybe I feel like I'm not getting enough oxygen, or even facial balance, or people are getting so many things injected into their faces, and you're talking about how the mandibular like can be pushed back. So I'm sure aesthetically that's a huge thing that like, oh, you don't need to do something surgically with that. You can just work on it to get your body into balance. And then a byproduct is you're going to look more symmetrical.
Yeah. Yeah, I think there's like so much to, I I love the work that's out there that helps us with like aesthetics. I think we talked about this yesterday because, um, sometimes aesthetics are a great way to like, for people who don't know about this, they don't know like why to do some of this healing work or, sometimes aesthetics brings people to be aware more about their bodies. And then that's the portal through which they look into that inner world, right?
Yeah.
And usually when you help aesthetics with like holistic or at least like holistic leaning modalities and therapies, it can bring about deep, symmetrical and inner healing change. But I like to go whenever we can from the inside out, not just like the emotions and the inner world, but working in the mouth or in the body and unlock these places that if given a chance, your body then would start to restructure and organize and create symmetry. So I was working on like your sphenoid and I was working on your mandible and, all these bones and even like that right zygomatic bone that was too scrunched in. And sometimes like even when I was trying to work more on symmetry and I was trying to get that bone to drag this way in my earlier years of working on this, and I was even trying to get the jaw to come forward, I wasn't going to the fascia and the organs in here and even lower. And when I started to do that, then I started to see this rippling up and I would see this like really big change without
almost like things are unwinding.
Mm-hmm. Yeah.
Yeah.
Yeah. So I think it's like sometimes it's an exploration to see each body's different and we might need to go into like checking you standing. And I have people like if I'm checking them in the chair and I'm working on them in the seated position and then the prone or on their back. Then I had you stand and I'm like, oh, all that work we just did, some of it went away. So now we need to work on you standing so that we can help align you according to gravity. And that's where I see more permanent change. And I think I'm also liking that because it leads to more depth of change within somebody's physiology, but also their structure. And with that, then we can see that it lasts longer. My work lasts longer now than it used to. I just get frustrated. I'm like, why do you keep coming in? I keep needing to adjust your right kidney. People are used to hearing me say that. I'm like, this is the third time I've adjusted your right kidney. That shouldn't be happening. Oh, because you have ab separation, diastasis. Oh, because when you lie on your left side, your kidney falls out of alignment. So we need to work on you in that position to titrate your body and customize it to the fact that when you're on your left side or right side, whatever it is, we can adjust the kidney. It'll stay aligned so your energy levels can stay high. And because the kidney often does influence the mouth, that can help your tongue, your mouth, and even your symmetry.
Wait, what did you just say? The kidney influences the mouth?
Kidney and the mouth are so connected.
How? Tell us.
Okay, well, so it's the rabbit hole of embryology. So embryology is the way we form. The kidney starts growing in near the sacrum. And then there's 3 kidneys in utero. We end up with 1 kidney. But this is what the embryology is so cool when you dive into it. I've interviewed the first 10 people on my podcast are world leaders in embryology. So it's a good listen if anybody wants to go listen to it.
I'm going to dive in.
The kidney starts in the sacrum and there's 3 of them. And then eventually like it comes upward and it lands as 1 kidney.
Okay.
So when we form, we're like this, right? We're scrunched up, little embryonic. And then as we form in utero, we start to unfold. And by the time that we get out of the womb and into the world, we're like, okay, we're this little newborn that's like this. But we start, it's kind of like our feet are near our mouth.
Yeah.
And also our kidneys and our hips and even our kidneys and our chest, they're so close to one another. But there's actually tissue that from the mouth and tissue from the sacrum that are kindred and related. And so another good example of this that I talk more about is the diaphragm forms in the throat. So when the mouth is forming at 4 or 5 weeks in utero, so for most people, you usually are born at 40 weeks gestation. So let's just say you made it to 40 weeks and you weren't born early, weren't born late. It's like 40 weeks. Well, at 5 weeks, 35 weeks before you were born, your mouth forms. That's going on. The same time your mouth forms, your diaphragm forms in your throat. Most people don't know that, right? They think of the diaphragm as this belly.
Wait, you're saying 35 weeks that happens?
At 5 weeks.
Oh, at 5.
So 35 weeks
your
before you're
mouth
born.
forms? Oh, 35 weeks before. Okay.
Yeah. So like if you have tongue tie, that happens at 5 weeks gestation. So then for 35 weeks, you're in the uterus, in the womb, growing and forming around a tongue tie.
Okay. Got
That's
it.
the thing that is like confusing is the way I said it. But so the same time your mouth forms, your diaphragm forms in your throat. A couple weeks later, it moves down to the chest, and then about 10 weeks gestation, it lands in the belly. So where it starts in the mouth, where you have 60% of us with tongue tie and those issues, there's fascia glued here. Because tongue ties are made of tight fascia. That band, that frenulum is really thick, bound up connective tissue. It's a different kind than the fascia in the rest of our bodies. It's thicker, and you can't stretch it. And so when the diaphragm forms here with a tongue tie, when it comes down, it's like pulling and stretch. The descent is not as easy. And so you see all this fascia that spirals into this pattern of restriction down to the belly. And this is the right side of the diaphragm is bigger than the left side on almost everybody. That's just the way the diaphragm is. The right kidney is more often bound up on that right side in 99% of people with a tongue tie or palate issues. And so why is the right diaphragm bigger and the right kidney misaligned? It's because of development and this spiral pattern of fascia that happens. So it's a mystery or like a very new concept because I made the map of this and I've introduced it to the field of when tongue tie happens, what are these 70 areas in the body, bones, muscles, fascia, and organs that twist and go into these vectors.
Yeah.
And that's what I'm teaching, out there. But for other people, we don't need to know 70 areas. I'm actually coming out with something called the Floor 4 really soon. I'm excited about this because when we didn't talk, the tongue press is the course I've got out there, which teaches people how to free up their tongues, do some amazing exercises, and even some grounding things. And I have this floor of mouth and tongue meditation that I put in there. But
I can't wait to do it. I'm super excited.
And it's really good. Some people say that that's like the first time they've experienced like freedom in their face and their bodies is by doing tongue press. But what I've got in the works I've already taught it to healers, but I'm getting to where I'm putting it into this, it's in the works to get it into something anybody can get at home, do this. It's called the Floor 4. And there's 4 main areas in the body that influence the mouth. And so distilling it down to 4 areas makes it so much easier
than 70.
Than 70. Yeah, I would say 70 and some
for lay people like us, we need just 4.
Well, I mean, me too. I get like, if I see something and it stresses me out, I'm like, I'm not going to do that. I told dentists this, and I presented at a lot of symposia, and I was like, yep, 70 areas. And they're like, okay, Neel, that's like amazing. I'm impressed, but 70? Come on. Like, they're like, yeah. Come on. Could you narrow it down? And I'm like, okay, top 10. So I presented on this symposium in the Bay Area, World Dentofacial Sleep Society Congress, and I had top 10. I was proud of myself, thinking like, good job, Neel. You whittled it down to 10. I had a dentist come up to me and he's like, yeah, I'm still confused, Neel. And I'm like, oh man, I just whittled it down to 10. So it was my wife, Dawn, who was like, she's my best coach, right? She's like, what can you do? And I'm like, you're right. But it's not that I made the Floor 4 to like create this thing that was super easy. It was like, all of a sudden, like I looked at the body in a way that I hadn't seen it before. It's, coming away from something and going back to it. I'm like, there's these 4 main areas: the head, the throat, the sides, and the feet. And there's a lot of nuance to that. That's why I'm teaching it. If you go to these 4 main areas and unlock those in specific ways, the mouth frees extraordinarily. And then the whole body experiences this phase shift. So I've kind of distilled this work that I do, which can take hours per session, like with you, and distilled the main parts of it down to this way we can follow these patterns to decode what constricts us to unlock and free up. And then we can get into, like with a freer body, we have a freer like voice and agency and intuition and some of those things that can be where we really need to get to for healing. So it's a melding and a swirling, soup of it all.
Sounds to me like there are so many aspects to our health, longevity, physical appearance, digestion. I mean, everything that's going to be benefit from working on our mouth and our palate. And an area that we probably never thought of. My daughters are in college and they always say like, "Mommy, are you mewing right now?" Like, and I'm like, "What are you talking about?" I guess it's like a TikTok thing where, because when they were little and we took them to the myofascial expert, I learned, oh my gosh, my tongue needs to be on the roof of my mouth. So during the day, I'll check in with myself, be like, where's my tongue right now? And since it wasn't something that I grew up thinking about, it's something new for me. And I'll check in once in a while and be like, make sure my tongue's at the roof of my mouth. And then they make fun of me, like thinking I'm doing a TikTok trend, like, oh, you're mewing.
No, mewing's amazing. I was just talking to the like Kevin Boyd, who's one of the world leading dentists. And so the guy that John Mew mentored is named Bill Hang. And then Bill Hang mentored Tim Yu and a lot of other people. And I work out of the office of Tim Yu, an orthodontist in Gora Hills, California. And so I love mewing. What mewing is amazing for is...
Tell us what it is first.
Well, John Mew created it, and he's better at explaining it. His son's better at explaining it. Mewing is just a way to move the tongue in a way that allows it to shape our face. People post videos, and a lot of my dental friends,
right now,
it's blowing up. It's been around for decades in one way, but it's become a lot more popular, and it's dynamite. What the Floor 4 is like the next level. Honestly, I'm going to say that's what's missing from mewing, and I love mewing, and I respect these guys. I work with a lot of them. I'm the direct people that Mew train. And what's missing from mewing is the Floor 4 is some people do mewing and it doesn't work for tongue-tied people as well. If you've had an anterior tongue tie and you try to mew, it jams your face up. So people that have a mild tongue tie or a grade 1 or 2, it works really well. But for a lot of people out there, their kids or them, the Floor 4 unlocks the organs that trap the tongue.
Okay.
So that when you do mewing or tongue press, which I'm really pushing people towards, it allows that to happen in a way that doesn't stress. It relieves. So,
what's the difference between mewing and tongue press? Because you've mentioned both.
Mewing is about the mechanics, and it's brilliant. Like that work is one of the ones that I would consider. Like you have like many amazing people out there, Robert Slovak, and that you would consider mentors. That work has been a mentorship, but what I would say that with tongue press, I realized that we're too stressed out. And even if we move the tongue and we have a trauma, it just wells up and it becomes a hard thing. So built into tongue press, I have a tongue meditation where I bring people through, and maybe we could do that, or I could just have us do it.
Let's do it.
Let's do it now.
Let's do it now.
Way better than words to explain it.
Okay.
Right? So, so you can do this, Tracy, where I'll just like tell you and walk you through this, and anybody listening, I'll do this in a way where you can do it if you're driving. It's nice if you don't have to do it when you're driving. So first of all, I want you to orient yourself. This is going to be about like 2 minutes or so of a little bit of interoception, tuning into your body. I'll have you do things with your tongue and movement, and then I'll have you open and close your eyes. That's just to set the stage. So somebody's like, what is he going to do? So if you want to close your eyes, do that. But I want you to become aware of where your feet are.
Okay.
You can take shoes off or keep them on. It doesn't matter, but it's mostly just about you have your feet. They could be bare or they could be in shoes or flip-flops. Where are those surfaces of your foot resting? So if your shoes are resting on your chair, be aware of that place. Take a second and just tune in. I'll also have you pick out a sound anchor. We have this nice waterfall. Pay attention to a sound around you and just listen to it for 5 seconds. And remember that. Okay. Now with your eyes closed, I want you to direct your awareness to your tongue. First of all, where was it a second ago? Is it on the floor of your mouth? Is it on the roof of your mouth? So if it's anywhere but the roof, go ahead and put it up there and get as much of it up there as you can. The front, the back. Some of you need to do the clicking sound just to make contact.
Good. Like suction it.
Suction it. And yeah, get the whole tongue up there, and keeping your tongue up there so it's stuck on the roof. Go ahead and open your mouth so your tongue gets a stretch. It's called cave or suction, lingual palatal suction. So now I want you to just take a moment, and in that stretch, so if you lost the stretch, go back to it, tongue to the roof of your mouth, and open your mouth so you're stretching your tongue. Feel where your feet are. Okay. If you're standing, feel how your weight is. If you're sitting, maybe feel how your bottom touches the chair or your back feels. Breathe. And then now I want you to come back and we're going to do a couple movements with the tongue. So I want you to take the tip of your tongue and I want you to coat the palate or the roof with your tongue, like you're painting it from side to side, from front to back. So you can start on the left and go left to right until you paint the whole palate from the front to back. And you're just gliding your tongue on the palate and the roof of your mouth. Then I want you to go from front to back. You can start on the left or the right and go front to back and glide your tongue. Front to back, like you're skating or sliding.
This is a
Good.
workout.
Now here's the part that's good. Now I'm going to have you take the tip of your tongue and push it onto the floor of your mouth. Inside the jaw, inside the mandible, the floor, the soft space underneath your tongue. And I want you to push your tongue into the floor of your mouth gently. Some of you, it'll hurt.
Hard?
So don't do it too hard.
I'm doing it hard.
But if you do it hard and it feels good, do it. So just start gentle and just coat the floor of your mouth with your tip of your tongue. And you can do the same thing. Go from left to right, from the front to back. And yeah, if you want, go ahead and massage. Like get the tip of your tongue into the floor of your mouth. Okay, we've done some work, but we want to step back from the work now. Relax your tongue. Don't pay attention to where it is. You have a tongue, it's doing what it's supposed to do. So we're just going to let go of that thought. Tune back in to that sound anchor. It could be an airplane flying over, whatever it is that you picked out, or if you didn't pick it out, or if you're hearing something else louder, just follow your heart and intuition and listen to that sound. And breathe. Then I want you to tune in back to your feet. And if you were paying attention to your bottom where it was in the chair, tune into that. Find where you feel your feet touching the ground, how it feels. Does it feel different? I'm not asking you, I'm saying explore that. Just explore where your feet are, where your body is, where your back is. And just notice not only the physical feeling of where your feet or your bottom, those areas are. Notice how your whole body feels, your speed of breath, your heartbeat or heart rate, or your overall sense. Do you feel more relaxed? Are you more aware of things you need to do? It's okay. All of those things are okay. Take this all as you probably activated an area of your body you haven't worked on in this way before. But more than that, it's tuning in to how your whole being feels. So let's tune in to a deeper thing than a sound anchor and the physical anchor in your tongue. Just pick an emotion. If you feel happy, if you feel sad, if you feel grief, if you feel you can't wait to do something, pick that emotion right now. And obviously don't dwell on it if it's negative, but I want you to just put that into your mind and then tune into your tongue. Find out where it is. If you want to put it on the roof of your mouth, go ahead. Find out where your feet are. And let that emotion just settle. And for those of you who want to grow it, if it's good, grow it. For those of you who want to dissolve it, let it dissolve. You notice there's no linear result of this. It's just to be tuned into your body and your being. And let that sound anchor that you heard be the last thing that we do. And go ahead and open your eyes. Okay. And then if you're lingering in a place, some people might want to journal, write out their thoughts, or just express. But
Wow, thank you for taking us through that. That was very interesting. I loved exercising my tongue.
Yeah.
I've done this thing where I've taken a towel and then pull my tongue out and side to side, Perry Nicholson, Dr. Perry
Yeah.
from Stop Chasing Pain. He has a tongue mojo course, and that was fun to get some awareness of that as well, where it's like, wow, it's really like when you do that, it's kind of painful.
In tongue press, I teach people how to do that. And what I found is that I love to do that. And I even do that with patients at times. But I love, like some people I've worked with, they're like, they wrap their tongue and they have sensory issues and it doesn't feel good. Also, if you have a tongue tie and you try to do that stretch, it can rub the frenum under the tongue on your teeth and it can nick it. So what I've done is I've found a way to get people to explore this where they use their own tongue and it frees up some of those same areas, but without the need to stretch it. But hands down, I love that stretch. So I do recommend it and use it. But I'm always telling people, if you're going to do that, be aware where your tongue is, because if it rubs against the teeth, it is really painful.
Yeah.
And so you wouldn't do that. It wouldn't be there for you because you don't have a anterior tongue tie.
Okay, so I can do it.
You can do it.
Yeah.
So totally.
Okay, amazing.
Yeah.
We're learning so many things.
It's fun. It's fun. Yeah. So within tongue press, I'm just going to talk about tongue press for a moment because it isn't just that. That's like a mini part of tongue press, but it's built in. There's like an 8.5 minute daily routine.
Okay.
Where I teach people how to do that, but mixed in with tongue stretching with a paper towel or gauze if you have it. And then also vocalizations that free the floor of the mouth, like different sounds.
Okay, I cannot wait to try this.
Yeah. So all those things built into a daily routine, and you can do it at the beginning of your day, at the end. It's like you do it in the morning to free up your body and just feel great during the day. You can do it at night to enter into sleep more easily. So it's great for like multi-purpose.
Okay, that's awesome. So that's so interesting because we know now that the face yoga,
love face yoga.
All the things you can do. I'm obsessed. I love like working with the fascia and the bones in my face too, because that's where there's stem cells in there. Get that activated. The bones are alive. Get them activated. And I mean, I don't know. I'm just trying to do all the things I can to preserve the integrity of what God's given me here. But I think that we are missing so many things, like with the tongue, and like if we can tie all those things together, then we can get a broader spectrum of taking care of our face and our whole body together.
Yeah. And that's what you brought in there was like, if it wasn't for these downloads that I would get from the ethereal realm, from God, like I wouldn't know any of this. It's not like I was figuring this out, like, oh yeah, no way. I was like, okay, I'm thinking about this, but if I just let go of that and follow the flow of intuition, that's how I started to like find ways to help people. Wow. And then out of that, it became a system. And then I started creating it. And then I made it into a flow so that I could follow it. But without those downloads, I totally wouldn't know any of this. So, okay. I want to ask you a couple questions, but so I'll give you like a heads up and you can think about it for a minute or two. On Compromise to Alchemize, I love asking people this question of it's based on my inspiration for the Alchemize part of my podcast is The Alchemist by Paulo Coelho. In that story, Santiago the shepherd is following a dream, and this mystical king, Melchizedek, asks him this question, or he says this phrase. He says, the universe conspires in your favor when you are pursuing your personal legend. And so a personal legend is like a destiny calling what you're put on this planet to do. I furthered Paulo's definition to say, but it's also like a legend on a map, that place in the corner where it shows you how many miles like a centimeter is, or there's trees over here. Like, so it's that place on a map that shows you how you know where you're at on the journey. So I want to ask you what your personal legend is, both in like, what do you put on this planet to do? I think a lot of people know. And then how do you stay anchored into that? Or what are the ways and practices that keep you on that path?
So I really feel like my personal purpose is one that we all have, and that is to be loved by God, to be able to experience the true unconditional love of divine. And when we are so filled with that love, then it pours out through us like living water. And then it's this like conduit for love where I get to receive. I'm not looking horizontally for love. I'm not trying to go, I need this person to like me. I need this from this. I am looking up to my divine creator and letting that abundance of love flow into me. And as it flows, then I become this conduit where I get to share it. And the way that I feel that I'm put on this earth to share that love is by reminding people of the divine crystalline structure that they are, that their body is 99% water molecules, and it is so divinely orchestrated that we are like an antenna sending and receiving information all of the time, and we get to choose the structure that we want to be based on the environments we're in, the words we say, the things that we think, the things that we choose to put into our body, and to be able to honor that and help people understand it on a whole different level. That's what I feel like. And there's so many things that we get to learn with water about the structures of it, the frequency, how light impacts the structure and how that structure impacts the function. We have so much more to learn. It's like the more that we learn about water, the more we realize how much we don't know. And it's such an exciting journey to be on. And that's why I feel like I'm here is basically to help people remember the love that they are and have hope again. Because so many people are in pain in their body, whether it's emotionally, physically, spiritually, they feel there's a deficit. And to remind them that they're not broken and that we get to just sit in the love of divine and everything we want is already there. And when we receive it, we come into coherence in our physical being. And like you were talking about, sometimes healing isn't just about the things we do or the things we take. A lot of times the most potent medicine is restructuring this water body back into coherence. And we do that with love.
Yeah. Love that. Wow.
Yeah.
So good. And so, I mean, it's like with that, I know it's been a journey you've been on. How do you like, are there like, how early did you know that in life in one way? And then how do you keep knowing that? How do you tune and tap into that reality that shows you, yes, Tracy, you're on the way? You know, is that, those times in prayer, meditation? Is it clues along the way? Kind of like paint that picture if you could.
I love that question. I feel like I was really blessed to grow up in a home where God and understanding the love of God was at the forefront of our home and the way that we were raised. And so I feel fortunate enough to, at a very young age, have had this like really strong hope and excitement that anything that I want to create in the world, I get to co-create with the divine, and it's limitless. And how exciting. The only problem I have is I can't do all of it probably, so I need to choose something. And then part of that path is learning, well, what are your gifts that you've been given? Because all of us have been given unique gifts.
Yeah.
And so then you get to discover over time. And so this has been a process discovering, well, what are my gifts? Chances are your gifts are the things that you love to do, that you're good at. You don't even realize you're good at it because it comes so easy to you that you don't even realize it. So it's like, oh, that's just, second nature. And other people are looking at you like, how do you do that? That's usually one of your gifts, right? And so I think part of it is life, like discovering over time. And so it's been a journey. And for a lot of people listening to this, I know I was just talking to someone yesterday who was like, I don't know what my purpose is. And they're feeling depressed. And I thought, I can relate to that. There's so many times in my life where you hit a stagnant place where you're like, what am I even doing? Why am I even here? What's my value? And it's almost like that next step where you take the things that you've learned, the trials, the crucible moments, and those are the things that build us. We aren't usually building in the joyful times. We're building in the times where we're being humbled and we're carrying our cross, and we're like, okay, this is heavy, this is hard. And that's where we're building the strength for that next step. So I encourage whoever's listening, if you're in that place where you're feeling discouraged, we've all been there.
Mm-hmm.
I've been there so many times, and I still hit that in life where I'm like, I'm kind of in that space now where I love what I'm doing, but there's like, I want to get even deeper. And it's like, how exactly do we want to do that? To what extent, to what level? And that's like, so it's a constant thing. I wouldn't say that it's something that's just like you become, right? It's over time. And a lot of time in life, I thought, well, I don't understand how me being in pre-med and doing all this medical stuff and then going into modeling and then investment banking, venture capital, how do those tie in together? Like, I'm spending so much time doing this and it doesn't relate to that and that doesn't relate to this. But what I do now, it all those things that I learned in the past, they're coming together and they've created the brand that I have now. If I hadn't learned all those things separately, I wouldn't have been able to be the full spectrum individual that I am at this moment.
Yeah, I love it. It's like, I have the picture of like an orchestra, and in your life, you have an orchestra of, amazing knowledge of where you've been, and also like as a conductor of this orchestra that is your life within yourself, like, different instruments that help you go from one season to the other. And when you can not only like be aware of what gives you joy, hope, and love, then you can like play those instruments when you need them, and like your brand, and it can like then influence the outflow of like what Hydrate is and what people need and why people come to you. Like, it reminds me of, I'm going to come back to you in a second because I have another question, but it reminds me of like when I was figuring out in Illinois, got my chiropractic degree, opened up a shop, and I was like, I just knew my time there was done and I knew it was time to move. But it was a hard moment because I thought, I always envisioned my life in Illinois in opening up a practice and then serving that community. But then I felt this moment by the river in my backyard when I was meditating and tuning in, and God showed me in a vision a bunch of things. And one of the things he said is, have you watered my children lately?
Wow.
And I'm like, okay. Neel that needs to know is like, okay, guys, you're talking about, have I watered? What do you mean? What are you talking about? What children? The babies? The kids? Because I, chiropractor to get. So he didn't need to say anything. I just need to step. Oh, right. You're talking about the people that I saw in California when I visited in Redding, where where we've been from 2010 until just 8 months ago. And you mean, have I brought nourishment, love, care to people? And who are the people? And that's how I knew I was supposed to go there, to Redding, and serve that community for a while.
Okay.
So, but then I got to Redding, and I got into this place of deep inspiration. And I was in a flow, like the beautiful moments. But then I got into a stagnant place.
Yeah.
And I'm like, oh my gosh, I just feel like depressed, and what's going on? And I feel like I don't know what to do, and like I feel so stuck. And I was just actually, this is going to make its way into the chapter of a book that I'm dictating. Anyways, recently I was walking the beach in the Bahamas in Nassau, and I was reflecting on this moment where this guy named Caleb sat next to me on the table. He came over, and the only reason he came over was because he saw the depression in me. He knew it was afflicting me, and he said, Neel, what's going on? But we didn't spend a lot of time digging into it. He's like, have you gone out and encouraged somebody recently? Have you prophesied over somebody? Have you given love? Have you shared? And I was like, yeah, I did. And then I'm like, no, okay. You're saying something and I need to listen. So I outflowed love and nurture and encouragement to some people I saw in the next few days. And that outflow not only brought light and brightness to people, but it broke down dams in myself.
Yes.
So I feel like for some of us, like, we need to be nourished and receive for sure. Hands down, some people, you need that right now. You need Neel or somebody else to go in an outflow.
Yeah.
But there are times in life when I've been like, oh, my lack is out of the underflow. I need to outflow and shine and share and really help people, because my sense of what I'm struggling from is not recognizing and being grateful for and aware of what I do have. And so I think when you can see somebody else like come into their awareness of something and be like encouraged, and like whenever we can do that, I think sometimes that is an answer to that.
Yes.
So I found that.
Absolutely.
Yeah.
Yeah. 100%. And I think most people listening to this can identify with that, or we've all had those moments where we're excited, we think we're on the right track, and then we hit that stagnant place. And I think it's just part of being human, you know, but maybe we get to get excited about that when we hit that stagnant place, because like, oh, we're hitting a new level, you know, when you're playing a video game, and you know, it's like it's the next level, and there's always that testing period before it. So maybe instead of getting upset, we get to get curious, and we get to get excited.
Curiosity. Oh, I have one more thought, and then I have a question. But okay, my brother Arun said this one sentence to me back in 2015, right before we had our daughter. And my wife and I had gone to Montana on that trip to, I was telling you about, was I telling you about that? We went to a friend's wedding, Glacier National Park was there. On that, we had just grieved a miscarriage, and that was horrible. And like, to say that out loud, I'm like, anybody that's going through that or any of that, I'm like, I feel for you. And I just want you to know, like, I'm a man who's married to somebody who went through miscarriage.
Yeah.
I lost my child, but it was early. Those that have lost, I know that it's the hardest thing. And so just let water and love come to you right now. There's nothing that replaces that. And when we were grieving that miscarriage, you know, anyways, I repainted a lot of our office furniture fuchsia because we were inspired by that. And we're like, it's black and white, but we need love and, you know, some excitement. So I painted all of it fuchsia. And anyways, one thing led to another, and I realized one day as I jogged to Trader Joe's 10 minutes down the street and back, and I sat on the couch wheezing with horrible asthma. And I'm like, what is going on? I can't even run. I had thought I dealt with this, and I realized I had been weightlifting and doing all this, but I hadn't challenged my cardio. So this moment in 2015, I was like, wheezing, horrible asthma that I'd had since I was 4, that I thought I was better with. And so I started running on the trip to Montana. And when I came back from the trip, I went from only being able to run like down the street and back with horrible wheezing for a half an hour, needed an inhaler, to I could run 1.5 miles without stopping, no asthma. So I'm on this run with my brother on the 5th of July, the day after we came back from that trip, and I'm running with him, and I start to get tired, and I'm hearing this negativity voice within me. I'm like, oh, I got to stop. So I say to my brother, I got to stop. And he's like, why? Are you having asthma? And I'm like, no. Oh, I don't need to stop. So I kept running, and I hit 2 miles.
Really?
Thanks to Arun. The next day I ran 4 miles without stopping. The day after that, I ran 8 miles without stopping.
Oh my.
And then 2 weeks later, I was in the British Columbia in Vancouver running the sea wall, 14 miles without stopping, no asthma. 9 months later, I ran my first ultra marathon, which was a 31 miler.
Wow.
The thing that kept me going during that ultra marathon and during my trainings was we had recorded my daughter's heartbeat, the one that we had 3 kids now, daughter Serenity. We got pregnant with her. My wife got pregnant with her while I was training for this ultra. So we recorded at the midwife our, Doppler, the heartbeat. And like I have all these 1-minute recordings. So I put them onto my iPod, old school nano silver iPod that I would listen to, plugged in the headphones, put a band around my, shoulder, my arms, so I could strap the iPod to it so I could run. Whenever I would get tired or weary, I would hear that song. Her heartbeat would come on. And I would hear it.
Oh, wow.
The cadence of a little baby forming in utero's heartbeat is fast, right?
Yeah.
When I was running the ultra, the Way Too Cool 50K in Auburn, California, back in 2016, I think we were like a few months from her being born. I was getting really tired, and it was a rainy season. So it was running through all these valleys. We had 21 creek crossings where you had to jump across a creek. When I got really tired, I had put in all these tracks so her heartbeat would come on, and I'd go, dee, dee, dee. I had this rap in this song where I said, I run to the rhythm of your heartbeat. It's teaching me how to love her through knowing her heart, so that when she was born, I had this cultivation of my heart. Well, anyways, I think that going from grief of miscarriage to hope of this daughter being born, defeating asthma along the way, I learned there were too many messy, dismal moments in there. From one day to the next, it could go in between.
Yes.
But yeah, for me, it was really helpful to like have that anchor of her heartbeat.
Yeah.
And stay on that path. Hear my brother's voice saying why. Because his one question to me, it wasn't a statement saying, Neel, you got to do it. He's like, why? And I'm like, oh.
He was curious.
Curious. Back to your curious word. I'm like, all I needed was a curious brother or friend to ask one question. And that question is changed everything. And a lot of questions, a lot of statements have changed everything. So I think it takes somebody who's willing to hear one word and change their course of action. But it takes one person who's willing to ask a question, stay inquisitive, but also to stay tuned in. Because if he didn't say that, and if people don't, so I think this is also an encouragement to speak up, so, okay, my question for you, where's a moment in life for you? There's a twofold question where you saw, when you spoke up and you saw how that helped somebody. So kind of like where you flowed out and it helped someone, and maybe it helped you too, but just kind of wherever that sparks you. What comes to mind?
I think the curiosity thing, because we can tell people our opinion, we can tell them what we think, and a lot of times that's not what people are looking for. They're looking for your presence, someone to hold space, to know I'm supported, I'm seen, I'm loved. And just like a therapist, a lot of times they're not telling you what to do, they're getting curious. Well, tell me about that. And then you start talking and you solve your own problem. So time that stands out in my mind the most is my two daughters. They really wanted to audition for a part in the play at school, and they were like in junior high. And they were so nervous, though. They're like, I don't know if I should do it. I'm scared. I'm scared to do it. And I said, okay, well, let me ask you this question. Is it that you're afraid because you could fail? Or you just are afraid that you might not like it and it's something that maybe you just don't want to do, right? And it was like this curiosity of sometimes in life we're afraid of failing, so we don't want to do it. But they didn't have that cognitive recognition yet to know why they were resisting it. It's like they wanted to do it, but they kept saying, no, I'm not going to do it. And so when I asked them that question, they both were like, oh, well, I'm afraid because I might fail. And I said, well, then to me as a mom, that's not a good enough answer. You're going to do it. If you just told me that you didn't want to do it, then you don't have to do it. No problem. But if you're not doing it because you're afraid that you're going to fail, then I'm going to push you to try. And they did, and they both got a part. They were so excited. They actually came out from the audition crying because it was they just felt so vulnerable. But after that, I think it was a good lesson to realizing that we don't not do something because we're afraid. We get to show up when we're most afraid. And that's when we get to grow the most. So I think actually being a parent is those are the moments where I feel like I'm learning and teaching and we're both growing together.
Yeah. Yeah, that's golden. Okay. Is there a time that flip it? Is there a time when you felt the most hydrated, nourished, and encouraged by somebody? Like go back to way back when, where you felt like maybe a wilting flower that all of a sudden got that water poured on you and that you hydrated. Is there a time that you felt it from the other way?
I feel like I've felt that so much in my life. There's been so many people that have poured into me. I can't even describe the amount of support and love that I've had in my life. But one moment that's just coming to mind right now is when I was in my early 20s, I reached out to a woman at my church who was in her 70s, and I asked her if she would mentor me because I've been in the church a long time. My parents, preaching the Bible and all these things, but I wanted to have a mentor, somebody that I could meet with once a week, that we would study the Bible together. I could talk to her about things happening in my life. And I would go sit with her once a week, and we went through this book called Experiencing God. And every time I would come, she would have like something baked in the kitchen, you know, some like tea cakes, and she'd have a special like Earl Grey tea or something for me to pick from. It was just like very comforting and loving, and she thought about it, and it was like these moments that I felt so poured into. So I think all of us get to ask people if they will mentor us, and then we get to mentor back too, right? So when you're having that symbiotic, I believe that the healthiest thing we can do as life is always having a mentor and mentoring and being mentored.
Yeah, absolutely. Yeah.
But it's intentional, right? Because I think there's people I could say that I have tons of mentors, but at each season in life, we can choose an intentional mentor and say, will you meet with me? Whatever time frame works for them, once a week, once a month, whatever. But will you meet with me on a consistent basis? I would love it if you would mentor me.
Yeah. It's such a powerful thing when you recognize we always have more to learn, and we need to, like, I love teaching and mentoring, but I love it when I get around someone and I'm like, oh, I have so much that you could, and it doesn't even have to be like they know a ton more, or they're like a lot older, or it could be like they're my age, or they're, they know this one thing. And I'm like, I'd love to learn that from you, and it's like beautiful way to do life is just to like recognize that we are on this planet and we have these gifts. And so many of us are like, we can't have every one. And then we aren't meant to. We're meant to like be in a tapestry of relationships where we can like co-nourish and encourage one another. So yeah, I've definitely seen like that mentorship model where if I ask somebody like, David Wyatt comes to mind, where I'm like, he was, he'd come in for sessions, and then he's a woodworker, like a master woodworker. And I'm like, could you teach me? Could you show me? Or I had a neighbor who was a welder, Terry, 84 years old, and he went to the same naval base as Elvis. And I remember, I adjusted his ear, and he had this whooshing sound in his ear for 3 years. It was like the ocean in his ear. I'm like, it sounds beautiful, but if you have a whooshing sound in your ear all the time, you don't want it. I adjusted his ear and it went away. But what I got from him was it was like, can you show me how to weld? And he's like, sure, Neel. And he had a welding setup in his garage. And like, he mentored me and he taught me how to weld. And I'm like, wow, this is the stories I would hear from him. I was like, I'm sitting in front of somebody who's had all this experience. He could weld all day, teach me all the things about it. And so I'd go across the street just to talk to him. I recognized too, like, he was lonely.
Yeah.
And so I gave him company, but I learned so much from him. And so it was that season in life in Reading where I would just go across the street and I'd be like, oh, Terry, can you show me how to do this? And he would. And I'm like, wow, I never knew I was going to get a lesson in welding. But it was more than that,
Yeah, exactly. It's like connection, learning. Yep. We all get to ask too. And it's the ask, right? Mm-hmm. Because I'm probably not going to go to someone and say, hey, can I mentor you? That seems kind of, hubristic, where you're like, yeah, let me mentor you. So we get to ask, like, would you mentor me? And I have had people come to me and ask, will you mentor me? And I think that that's the most beautiful thing, where it's like, yes, absolutely. But we get to ask those people, because I think most people love to do that. We all are busy. We all have a lot of things going on, but we also know that one of the biggest gifts in life is to be able to give back. That's where the biggest joy comes from. And some of the most profound healing for ourselves and the most filling of that joy inside of us is when we get to serve.
Yeah, definitely. Yeah.
Well, thank you for being on this show, Neel. It was such a pleasure to have you on. Is there anything that you want to share with the audience before we close out to let them know? We'll put in the show notes about your courses. And I know you meet with people one-on-one, just like you did with me. And people can go to your website and book. You're in Santa Barbara. You also go to LA and then Reading as well, or?
Right now it's it's definitely Santa Barbara's home, and that's where I love people to come. And then I also do like a day in LA, a day in Agora Hills.
Okay.
And then I go to the Bay Area as well.
And sometimes in San Diego.
I mean, sometimes in San Diego. Now all of a sudden I'm like, oh, it's so good to be here.
Now you're going to be in San Diego.
So yeah, so people can just like, babies to adults, babies, kids, adults, any of the things we talked about. I love helping moms through the prenatal, infertility to fertility, prenatal, postpartum, or families, or, you know, when we're talking about like getting through those, you know, peak performance kind of mindset changes and body changes. And I do have that 2-day experience where some people are, I was telling you, somebody just booked, they're coming in from Texas, somebody's coming in from Vegas, somebody's coming in from Utah for the system reset experience where over 2 days, we do like 9 hours of body work, an hour of movement rewiring at the beach if you're in Santa Barbara or there's a beach nearby. And we do like a pre and post consult to set it up and give you recommendations after. And it's just like this really like chrysalis type healing experience. Some people might be like, can I really take 3 hours of body work? And I'm like, it doesn't have to be deep or rough. It doesn't have to be all body work.
It didn't feel like 3 hours.
Yeah.
When you were done, I was like, whoa, we finished 3 hours. It felt like an hour. You know, it wasn't at all like this big monotonous like thing, and it wasn't painful. There was some moments where it was just like a little bit like, okay, what was that? But it was really nice, actually. It's very pleasant.
Yeah, good. And I mean, sometimes that is like getting to the root, and then things are easier and there isn't as much depth. It's more like finding out what people need. So it could be all things, just the healing that someone needs, and how can I help facilitate that? So I love it when people come for that. And so that 2-day experience is something I'm like featuring now, is like, come, we'll do a lot in those 2 days that'll just change things and catalyze you and put you off into a direction that's going to be better than when you left. And but some people might just want to do like a virtual session, and I do that. Like, where I just do virtual sessions to help guide people, whether they're on a process or they're like, I just don't know how to figure out this thing. Well, I can problem solve it remotely, virtually. I usually work through like inference and observation, but I also can feel what people feel usually. Even if I'm working virtually with somebody in Turkey, it's like, oh, her right kidney's out. I could feel it in my body. So I taught her how to release her own kidney, and her back pain went down tremendously. And then, so just, I love to help people. So I think the 2-day experience is really good because you get to see a lot happen.
Yeah.
So if anybody can come, you come. And I do that in Santa Barbara, but I also do that in LA, and I also do that in the Bay Area, maybe San Diego. So we'll see. But, so it's just, you know, definitely encourage. And then I have a podcast, Compromise to Alchemize. Tune in. I interview a lot of amazing people. I know this is going to be on both of ours, and I think that it's like just helping people through the journey, giving resources, giving keys. And I just love that. So,
yeah. Thank you for being here. It's been an honor and a joy, and I'm looking forward to getting to know you even better.
Yeah, I'm so excited. Thanks for having me.
Thank you.